GMS Studios. My name is Rich Hart, and I'm with, ready for this, Barbara Khozam. Barbara, very, very, very nice to have you here. Okay.
I'm excited to be here.
Here's the thing. So today we're going to be talking about patient experience. And you have some inspirational on this one because you helped mom, all right, through her detriments, all right, and her cycles themselves and things of this nature. And you've probably been in every medical office in the entire world, all right, without a doubt.
Many.
And so what's this patient experience all about? You're in the medical field. You're working with, and so we're going to say a patient experience.
Yeah.
Okay. So what's this patient experience all about?
Well, it's about being present
Okay.
with patients,
Okay, good.
each person, each moment.
So everybody sees this differently. Everybody has a different view, or their different ailments and different ways themselves they're dealing with this. Okay.
Right.
That's a big undertaking, my dear. Okay. A 10,000-foot level out there of taking care of the world. Okay.
Yeah.
So how does this patient experience start?
Well, patient experience, what's a big topic?
Yeah,
right?
it is.
And whose job is it to deliver a great patient experience?
We hope it's not the receptionist.
Oh, that poor person gets blamed for everything,
They
right?
do.
That's the front desk.
They told me, and it was she, and I can't remember her name, thank gosh, right?
I know, but it's every touch point. So it starts when, what do? I'm a patient. I'm going to Google, I need a chiropractor, blah, blah, blah. Well, my first touch point is reading the reviews, right? Uh-oh. So, and a lot of practices, I don't think, invest enough time or energy into monitoring those reviews, doing things to raise them.
Sure.
Right. And then what do? And then I'm going to go to the website because I got to go to the website. I can't find a phone number.
You never find a phone number.
Oh, there's another touch point. And then I pick up the phone and what do they say? Can I help you? And you're like, what? So each touch point matters.
Sure.
So that's what I help my clients with. I help them with the touch points.
So who are your clients then?
Oh, gosh, all kinds of healthcare. So medical plans, optometrists, veterinarians, dentists,
anybody that
primary
communicates.
Care, anyone.
Yeah.
There you go.
Anybody communicates themselves with the end user, all right, wanting a particular service.
Yes.
All right, that engages.
Yes.
Now, there's many times, Barbara, that I picked up the telephone, made some calls, and I says, you're kidding me, right? All right, this is the way this works. And the worst part of that is they were referrals from my doctor.
Oh.
And so that's casting even a bad light on where the referral came from.
That's correct.
Okay. And then the individuals themselves now you're talking to. All right. And this is something that services themselves across the board. This is not something, all right. Individuals themselves lost the pride about what they do as service providers, I think.
Right.
Okay. And they had treated it just like a job. I'm here for X amount of hours and I get paid X amount of dollars.
Right.
Okay. So that experience kind of takes a back seat.
Mm-hmm.
All right.
Agreed.
So how do we help people in this? How do we drive this level of patient experience?
Well, it starts at the top.
Sure it does. All right. So leadership has got to get together.
That is correct. And the problem, especially in healthcare, is they're overworked. Understand, everyone's low staffed right now.
Sure it is.
But in healthcare, they're really burned out.
Mm.
So now we've got burnt out staff. We've got leaders who don't recognize them when they do something great,
right.
or they don't confront the non-performers.
Yeah.
And so then everyone's mad and there's drama. Well, they're not going to deliver a great caring experience to patients if they're not taken care of. So
you're telling me it's top down.
That's correct.
Okay, from top down itself, and now it gives us the opportunity to self for improvement. Okay.
Yes.
So you're now working with the leaders.
That's correct.
Top ends, entrepreneurs, individuals themselves.
Yes.
The folks themselves that are making decisions often don't get down, all right, to that lower level for the individual who's taking the call.
That's right.
Barbara, this is my experience.
Yeah.
Okay.
Right.
And so by you laughing is telling me that my experience is true to form.
That's correct.
And it's also telling yourself that my experience is not the only experience that I felt.
Right.
Okay. How do we change this?
How do we change this?
What's the direction? All right, for this, we got to work with the upper levels.
That's right.
To bring this down, to understand what middle managers need to do.
Mm-hmm.
Maybe the office managers, if that applies in that particular case.
Yeah.
Getting down to those individuals themselves that have first touch. All right, to what? potential clientele.
That's
All
right.
right. They don't call them clientele, they call them patients.
Right.
Okay. And it's to the level of patience that somebody's got to pick up the phone to try to get a hold of those themselves to say, I'm a patient and I would like to what? Find somebody with patience.
That's right.
All right.
Exactly.
So how does this,
Right.
what do we do now? All right. To now help people serve, all right, the purpose. All right.
So what some of my clients have done is they are very big on huddles, daily huddles.
Okay. How's that working out?
So for the ones that do it, it's great. But here's what's cool is that it starts at the front line, like
Okay.
front desk, for example, or medical assistants. They'll
Right.
have a huddle. If a problem arises there, then the next huddle is the management team.
Right.
So if the problem is something's going on, it's addressed at the management level.
Okay.
Management then half an hour later, there's another. So each level has a huddle half an hour after the other one.
Right.
So the CEO knows that day before lunch
Mm-hmm.
what's going on down with the front line,
Good.
right? Fixes it.
Right.
Okay, can you imagine? Like, what do staff think when they're like, hey, we brought this up and they're working on it like today?
Yeah, right, exactly.
Because the communication line's open.
Direct implementation.
Yeah.
You know,
And they're actively seeking out feedback.
good. Superb.
Top down. Yeah.
Is it working for most? Is it individuals themselves that are reluctant to put that kind of change in? Or it's just like, I'm going to just really reach out and say the doctors themselves are already in scheduling. We know the connotative thought of doctors, you're going to go in there and before you get seen, okay, that experience is you're going to actually order a pizza, okay,
Right.
before you get in.
Right.
All right.
Right.
And because you're going to be in there, your appointment was, say, 11 o'clock, but you won't see the doctor at least 12:10.
Right.
Okay. You've already blown the experience
Right.
out of the water. So
Right.
how do we help those individuals? How do you help those individuals remedy that? Because that's the first touch.
You mean this waiting?
Well, it's the second touch because they had to make the appointment first.
Right.
You know?
You mean the waiting?
Yeah, the waiting,
the
and
constant waiting?
Yeah.
We've got to get on top of things.
Right, exactly. And that's it's from the top down.
That's
all right?
correct.
It's,
And providers, the
Yeah.
providers don't realize they're leaders. So they're doctors, and they come in late and like they're part of the problem.
yeah. I'm sensing a little frustration here.
Yes. Oh. And it's like the staff are like, well, the doctor didn't even say hi to me. Why should
Yeah.
I say hello to a patient? I'm like, oh, it's
So it sounds like the fix is better communication,
mm-hmm,
better allocation,
mm-hmm,
okay, and better probably really getting out there and identifying, all right, where the problem may be,
Right.
all right, from a source, all right,
right.
and then getting it down to the smallest. I'm not going to say lowest, the smallest already attention. I believe in the fact that self-service themselves as a service provider, okay, whether you're calling the plans or whether you're calling the individual offices to set up, everybody has a couple different ways. Service to me, all right, from a medical perspective, okay, if you don't show up, we're going to charge you X amount of dollars and everything. And there's a lot of things out there that
Right.
they'll do.
Right.
They charge extra, they bill it out, and everything else like this.
Right.
I've went to providers themselves that have made drastic mistakes. Okay. Sent wrong medications to the
Mhm.
pharmacist and things. And it's just,
Yeah.
it's painstaking.
Right.
Okay. And individuals themselves, just like this guy right here on the other side, turning around and saying, I really don't want to go to those folks.
Right.
Where's the witch doctor?
Right. Exactly.
Where's the guy with the
Exactly.
bone in his nose? I want to talk to
Right.
him,
Right. And there's so many options.
So what's your remedies? What are the things themselves? How do we now put this into play? All right.
Well, like I said, it starts at the top, but everyone needs to buy into the fact that we're going to treat each other with respect.
Good. Superb. Excellent.
Right. So
Good.
if the owner of the company and let's say the doctor, and they're like, yeah, it's true. We need to treat everyone with respect.
Right.
That's going to trickle down.
Sure.
And it'll fall through in your workflows, in your policies, and everything.
Right.
But you've got to make it clear.
So how
in
do you
your
bring this?
vision.
Do you bring this to the doctors themselves, those offices themselves, or is it more of a conference? And you're speaking at conference and things of this nature, and then breakouts, and then maybe study groups and teams and things of this nature. What's your best way of delivering to get people on the same mark?
Yes. So I do conferences and speaking and breakouts, but I'd like doing consulting
Okay, good. So,
where we work together, because you go to a speech, yay, we need to be nice.
right,
Wah,
exactly.
and
You
then
know how
what?
long that lasts, right?
Exactly,
Until
42
they get in the car.
seconds. Right, exactly.
All right.
So, yeah, I like to work more long term so we can really fix the problems and
Good.
improve.
If there's one thing itself that we can leave out there, all right, with the folks in the audiences themselves, knowing patient expectations, all right, patient services, okay, is key
Mhm.
number one. Okay.
Yes.
What's that one thing itself, besides what we're saying, communications and things themselves, that you want to instill on the folks themselves listening right now?
Gosh, regarding patient experience, I think what it is being present,
Yeah.
whether it's with your employee or with a patient, because an upset patient, what do they want? They want to be heard.
Yeah, right.
And if I could just simply listen and go, gosh, I'm sorry that happened to you.
Yeah.
Let's talk about some solutions.
That's right. Exactly.
They'll listen.
And that's fine.
Yeah.
I'll listen.
Yes. Yeah.
But
Like wait times. Oh my God, I'm sorry. The wait's going to be about 30 minutes.
that's
Can you
right.
wait?
Exactly. That's
Or
right. Yeah.
do you want to?
Doctor's a little backed up right now.
Yeah.
All right. He
Yeah. A
came
little
in
back
just
to,
off a vacation. He was on the great hunt in Africa. It's like, okay, yeah, be creative with your with your verbiage out there.
yeah.
But I think you're right itself. I think is really connecting with
Yeah.
those particular individuals themselves. And I
Yes.
think it's extremely important to working and building that dynamic.
Yes.
All right. That service themselves is predicated. All right. And long-term service themselves
Absolutely.
is absolutely needed.
Yes.
Without a doubt.
That's correct.
Barbara, how do people reach you?
Oh, they can go to my website.
Is
It's barbarakhozam.com.
good, superb, excellent. Any other ways they can reach you? Social sides or anything
Oh,
else?
LinkedIn. Yes, I'm all of them.
Barbara Khozam.
LinkedIn. Yes.
Well, Barbara, it's been my honor and distinct
Yes.
pleasure to have you here today. Thank you.
Likewise.
Your services are definitely well needed because I've been there.
Yeah.
Okay? And I've experienced already everything itself you're trying to fix tenfold, 10 times over. Ladies and gentlemen, thank you very much for themselves. Barbara Khozam, right? Going to fix those problems here in the GMS studios themselves here at NSA Thrive. We'll be back real soon. Thanks for listening.